Good afternoon, everyone. Thank you so much for joining us today. My name is Roberto Valdez. I'm the Community and Government Affairs Liaison for the Latino Policy Forum. We're going to have folks joining us as we continue this conversation, but please, thanks so much for your patience. I'm going to go ahead and share my screen today. I hope everyone can see it here. Second, there we go. All right, great. Perfect. So COVID Forum Analysis, a webinar conversation. COVID-19 remains in balance for Latinos. Again, my name is Roberto Valdez. I'm the Community and Government Affairs Liaison for the Latino Policy Forum. I'll be the moderator, or as I like to say, I will be directing traffic today. We have some great panelists and speakers for our conversation today. And kind of just to set the stage, we'll do a brief intro, which we're doing right now. We'll do a quick data presentation, the information that you received last week via our email blast. We'll have a conversation with a couple of our health experts, and then hopefully we'll have enough time to answer questions that I'm sure you already have. As far as questions go, you can go ahead and add those to the chat box, or you can email me. I believe I sent the email address in the follow-up email for everyone, but it is rvaldezjr@latinopolicyforum.org. If we don't get to your questions, we'll try to follow up with answers as quickly as possible. So for our speakers today and presenters, we have Silvia Puente, President and CEO of the Latino Policy Forum. We have Carmen Vergara, who is Chief Operation Officer with Esperanza Health Center. And then Dr. Maria de Rios, Emergency Physician and Professor of Clinical Emergency Medicine at UIC. Before we get to Silvia's presentation, we know that recent data suggests that the dramatic impact of COVID-19 has had on Latinos and communities of color in Illinois has worsened, right? And there's really no sign of it getting any better. And so we really felt it very important to have this conversation, not just from the data perspective, but also understanding what's going on the ground and in our communities from actual people, and try to make that connection. And so we'll start that conversation off today with the data presentation. And with that, Silvia, the floor is yours.
Thank you. So I want to spend just a few minutes talking through this data just to make sure that we're all on the same page. And let me say thank you, Roberto, and let me also extend my thanks to Dr. Del Rios and Carmen for spending time with us today to share their insights. And let me thank all of you who are watching this webinar. You know, really, I can't understate the significance of what I believe truly is a crisis that we're facing in the Latino community that is led by this healthcare crisis of what COVID has broken, but also has accompanying economic crisis in many communities, but as this data indicates, particularly the Latino community. So not everybody has seen the data presented this way, because this really does provide a cumulative assessment of the number of COVID cases in Illinois. So this is everyone who has had or currently has COVID. So these numbers are never going to go down, right? Because we're aggregating them. And this chart is even updated from what we were able to send out last week. So it tells us that for every 100,000 Latinos in the state, 3,124 have or had COVID. That is 3% of all Latinos in the state of Illinois. It is 2,000 for every 100,000, 2011 for every 100,000 African Americans, which means about 2% of all African Americans in the state of Illinois have or have had COVID. Again, disproportionately impacting both what we know Latino and African American communities. And for Asians and whites, the lower bars there, the blue and the yellow, it's just under 1,000 for both, so just under 1%. So we're seeing COVID impact African Americans twice the rate of whites and Asians, and Latinos 3 times. And given the slope of this graph, for those of you that pay attention to these things, you can see that the slope is widening and the slope is the steepest for Latinos, which means that the rate is just not abating, but is just more and more as the weeks pass. when we first started tracking this data way back at the end of April, up until just the other day. Next bar, next graph, Roberto. So this is just a graph of the last bullet point that tells you where we are as of September 13th. Again, with where we are with respect to Asians, whites, Blacks, and Latinos. So nothing, this is all on the last graph, but you can see it a little bit differently. The next one, Roberto. Now this table I know is sort of a lot to take in, and we sent this out in advance, so I hope that you were able to review it. But we have been tracking, this is all this data is coming from the Illinois Department of Public Health website. So these are the 15 zip codes with the most number of COVID cases in the state of Illinois. And those that are highlighted, 11 of the 15 are Latino majority communities. The ones that aren't highlighted are other communities with also very high incidence of COVID. Under, you have the community name, the zip code, the community name, then you've got positive cases, testing, deaths in these particular communities, and the Latino population. So if you just look at that first set of columns under positive cases, it indicates the number of cases of COVID that are in each of these communities. And I hate to say that it's sort of a race for the top of which is the worst, which changes hands from week to week. Because as of earlier this week, or as of August 31st, South Lawndale, which had been number 1, is now number 4. But all of the top 4 or 5 have been in the top 5 almost since the beginning of the time that we've been tracking this data. So there's Chicago Lawn, Belmont Cragen, Hermosa, Brighton Park, H Park, South Lawndale, Cicero, Waukegan, Aurora, surrounding municipalities with large Latino communities, the Lower West Side, New Cindy McKinley Park, and then Portage Park and Berwyn. The first column there under total cases is the actual number of COVID cases in each of these communities. So in Chicago Lawn, it was 4,711. In Belmont Park, it was Belmont Cragen, it was 4,403. And then the next column over represents the rates per 1,000 population. So when you look at Chicago Lawn, that 42.12, another way of thinking about that is you move the decimal point over. That means that in Chicago Lawn, 4.2% of the total population in that zip code has or had COVID. When you look at Belmont Cragen, it's 48.64, which means 4.86% of the people have or had COVID. When you look at Cicero, the highest, it's 49.56. That means 4.9%. So what we saw that overall in the state of Illinois, 3% of Latinos have or had COVID. In these communities, for most of them, it's over 3%, and in some approaching 5% of the total population having or had COVID. Next slide. And if you have questions on any of this, please put them in the chat box and we'll be happy to get to them. And here we've just mapped out the data so you can see where these communities are. And so particularly the Southwest side communities, we've been able to see the individual zip codes. We have an increasing concern when you're seeing this density of the number of COVID cases as presented in this geographic map. COVID is not an isolated incident. We are really beginning to see a broader community spread of COVID in our communities, which is, and we'll hear from our physician and healthcare professionals, just how challenging that is and how difficult it's going to be for things like contact tracing to be effective. Because when you're walking outside your door every day and 4 and 5% of the community that we know of has or had COVID, and we know that those numbers are probably even undercounts, given that we know that Latinos have the highest levels of uninsurance, and we've heard reports of many people being afraid to go to the hospital, these are really probably conservative estimates of the true incidence. We really are seeing a geographic spread of COVID in our communities, which means, you know, it continues to boggle my mind. How do we contain and stop the spread when it is so pervasive and so prevalent, not just in these individual zip codes that I've highlighted, but you can see this particular corridor of the southwest side of Chicago, and obviously not quite as dense on the northwest quarter. Your next slide, Roberto. For the first time, we started to take a look at the actual death rates, not in these communities, but this is another way of looking at the death rates. Again, grim news, not happy news, folks. This represents the 15 zip codes with the largest number of deaths, reported deaths due to COVID. And again, the ones highlighted, and I believe there are 7 of the 15 zip codes with the most number of deaths are Latino majority zip codes. So those yellow bars are Latino majority. And you can see there, here you have the same set of how many cases there were in these particular neighborhoods, how much testing was done in these neighborhoods, and the amount of morbidity in each of these communities. So this is the first time where we've been able to say that in neighborhoods with high preponderance of Latino cases, we're also seeing high preponderance of deaths. So we would say that the narrative is somewhat changing from what we saw early on, where we still certainly are seeing disproportionate number of cases and deaths in African American communities. We are now continuing to see the increased prevalence and disproportionate number of cases, but also deaths in the Latino community. And this is a map of those 15 zip codes with the highest incidence of death rates. And you can see how that's a bit more geographically spread out throughout the city. Is that it for me, Roberto? Yes. And please put your questions in the chat box and we'll be happy to answer them.
Great, thank you, Sylvia. Let me see here, I'm trying to get my video back on here. There we go. Thanks so much, Sylvia. And there was actually, the zip codes on deaths was actually the incorrect zip code list. I'll actually share the correct one once we finish with this conversation with our health experts. The map was correct, but not the list. So my apologies on that. I want to make sure that we're showing the right data.
Is it just a matter of the date, Roberto?
No, it was actually the list that you were talking about, Sylvia, was zip codes by tests versus deaths, because we also did that data analysis. But the data on deaths was shared in the email. And again, I'll make sure that the right zip code list is put up at the end so folks can understand the right data. Alrighty, so moving on to the next part of our webinar. As mentioned, we want to make sure that this data that Sylvia just presented is translated into kind of real world terms, understanding what's going on in the community, what our health experts are hearing both at their workplaces as well as in the communities that they live and work in. And so we have Carmen Vergara and Dr. Marina del Rios for that. And so I want to ask a few questions to them both, and hopefully we can get a dialogue going. Sylvia mentioned any questions for health experts, please put those in the chat and we'll get to them. Let me pull up the first question here. Alrighty, so the first question, and I'll ask Carmen to answer first. The data that Sylvia just presented, what do those numbers that we saw there and that we've been seeing, what are you hearing, or how does that translate to the community that you serve? What are you seeing in the community and in your workplace that really kind of connects the data to the work that you're doing?
Yeah, well, hello to everyone, and thank you for the invite to be here to share our story over at Esperanza and what we've been seeing. The data that Sylvia shared really aligns with what we've been seeing. We have 4 federally qualified health centers all on the southwest side of the city of Chicago, and the biggest neighborhoods that we serve are South Lawndale, Brighton Park, Gage Parks, all of the neighborhoods that we just heard about. And we've seen like a huge demand for testing. We've tested close to 12,000 patients since the beginning of the pandemic, and we knew like right from the beginning that there was definitely the exposure was happening in these communities. And when we were starting to ask patients where they thought they might have been exposed, the workplace was coming up over and over again. And really it was due to not being able to have safe working conditions in their place of employment, not being provided PPE, and feeling the need to continue to go to work, to put food on the table. And so they were really worried that if they, a voice to the employer that they tested positive, that they might seek retaliation and that they might lose their employment. And so they were really risking their lives by going in. And so as much education as we were doing, the best thing to do was to, isolate. It really wasn't happening. We just really felt that that wasn't something that they could do. And what we started noticing was that many of the folks who were coming in for testing had never been to Esperanza before. So of the 12,000 who we've tested, at least half have new, they're first-time patients, they're uninsured. So this tells me, even as a healthcare professional, that there is this subpopulation who was already out of care, who was only now seeking care because they needed to. And so, we're finding out things. This pandemic is definitely highlighting things that we maybe suspected was there before, but now it's just like so obvious and, completely aware for us.
Thank you, Carmen. And Dr. De Rios, same question, obviously different perspective that you are an emergency physician and a professor as well. So just curious to get your perspective on that.
Well, so one thing I can say is that we've continued to see patients coming in with influenza-like illnesses to the emergency department throughout the summer. Usually we have a lull. You think of influenza season as early in the year and then late in the year. In the summer, you're usually spared except for the occasional summer cold. But we've still continued to see people with body aches, fevers, headaches, loss of sense of taste and smell, all the telltale signs of COVID. And we continue to have positive cases. We did start at least to see that patients aren't coming as sick. So I think at least the word has been spread out to come in to test early. And so I think that probably is making a significant difference in patients' outcomes, and that people are showing up earlier to get tested and hopefully are getting better informed as to how to protect themselves and what kind of things to look out for to come in the hospital to get tested. But like Carmen, I'm seeing a lot of people that are uninsured, a lot of people who report that they found out that somebody at work was sick. In fact, I had a young woman who thankfully ended up not having COVID, but was worried about it because in her workplace, she had actually resigned the week before because it was very clear to her that at her workplace, they weren't being strict about maintaining proper precautions and weren't providing things like adequate PPE, proper distancing for the employees. And luckily she was in a economic situation where she could quit. But there's a lot of people that don't have that option, right? And one person gets sick and it just goes through the entire family. I've also seen people that have come in and they themselves may not be working or staying home with the children, but their spouse or their sister who lives with them, or in one case, I had one woman who had both her mom and her aunt living with her, and they both were in high risk work locations. One worked at the airport and another one worked for Amtrak. So both places where you're exposed constantly. And so unfortunately, this is just a continued risk in our communities.
Thank you. And with that, question around the barriers that you're seeing from your patients. We did talk about the uninsurance, talked about, maybe potentially cultural differences, but I'm curious to see what barriers you're seeing that can be classified as specific Latino barriers with your patients. And I'll ask you, Dr. De Rios, if you can address that first.
Sure, I think that in addition to the barriers to getting tested without having to worry about the cost repercussions, right? Then it's the barrier of when you test positive, what resources do you have available to ensure that you're being properly monitored, so that if you get sicker, that we can intervene right away, as opposed to having people end up in the hospital for long periods of time in an ICU, right? And I think one of the biggest barriers is that a lot of our population are primarily Spanish speaking, and let's face it, a lot of our hospitals are not adequately staffed to be able to speak with people and provide them instructions that are easy to understand in Spanish. And so add to that the fact that a lot of hospitals have as a policy now to not allow visitors because of the risk of transmission, not only to the patients that are in the hospital, but also to the visitors themselves, trying to protect our visitors from getting sick. That's become a real barrier in just trying to ensure that we're asking the correct questions from people to understand how sick they really are. And so I have heard reports of people that were sent home when they probably should have been observed in the hospital longer, or at the very least provided an opportunity to be monitored more closely as outpatient, and then end up returning very sick. And so that's one thing that we've been trying to, and some institutions have been better at trying to find ways that if the family can't be at the bedside, to be more supportive in providing technology to either FaceTime with family members or at least have them on the phone consistently. And so that's one thing that I think that is really important for the population to know, that you should advocate for yourselves and ask, if I can't have a family member, can you speak with my family member over the phone? Particularly if there's no interpreters that are in person. A lot of hospitals have telephone interpreters, but let's face it, it's different from having an actual human at the bedside. And so making sure that we're advocating for our family members, and that we're really being a nag with healthcare providers to ensure that we're getting the right information to our communities.
Carmen?
Yeah, I think I want to highlight what Dr. Del Rios just mentioned about assessments in the hospital. We had occasions where patients were discharged with oxygen tank, but weren't given a pulse oximeter, or weren't even given instructions in their own language of how to use that oxygen tank. And so then we were following up, trying to do our best to fill in the blanks there, but some patients didn't fare well, with that process. And so there you see that, the literacy level too is also like a huge barrier, even with, understanding COVID and how it works and how it spreads. And, there's so much data being shared and thrown at folks that I think that that's also really has been a barrier as well, really being able to understand the significance of COVID. I would, also maybe add the access to grief counseling. We've had a lot of families share that they've had family members pass away, and as Latinos, part of our culture is to be, show affection and to be with each other during these difficult times. But with COVID, you're not allowed to be affectionate and be together. And the need for grief counseling has grown. Grief counseling in Espanol is also something that you don't see access to that. And so, and then there's the technology. All of the counseling is, being done through telehealth, but there's privacy issues. If you're gonna, have a counseling session, you definitely want to have the time with your counselor there. We've had Esperanza counselors do grief counseling with multiple members of the same family who lost a family member, and their biggest problem at the moment was that the guilt that they were feeling from not being at the bedside when their family member passed. And so we definitely see that grief counseling has been a huge need.
Yeah, it's so interesting that you mentioned the affection part of things, and me personally, I luckily have not been in a situation in the hospital where I've had to go to that, but I've been spending time with my mom, and we were at the store the other day, and she saw one of her friends, and her instinct was to go hug her, and I had to just stop her and say, "Mom, you can't hug her." and she realized it. And so I can only imagine how amplified that is when someone is bedside and is, trying to, comfort their family. So I appreciate you sharing that, Carmen. Next question that I have, really, and maybe you've answered this to a certain extent, but I'm curious to understand maybe the challenges and barriers that you're facing at your workplace because of COVID-19. I know that's a very general and broad question, but we know, from the beginning of the pandemic, there was shortage of PPE and whatnot. So that, that's one minor example back then. But I'm curious, any barriers, challenges that you can share with the group that really puts into place how hard this work really is. And I'll ask Carmen if you can go first, please.
Sure. I think I could probably start with primary care services and the delivery model that has moved from in-person to telehealth. We've been in this pandemic for a little over 6 months now, and it was the first few months when we transitioned, we thought it was, best to transition to telehealth, especially for those with chronic diseases like hypertension and diabetes, because we thought, it was safer for them to get this care at home. But as we're coming up with 6-7 months now, it's time for us to do vaccinations for them. It's time for them to get their labs drawn. And so those challenges to make sure that those who were controlled prior to the pandemic continue to be controlled have been challenging. Telehealth has been really convenient, and it's definitely been transformative, but we still have patients who they have challenges with telehealth. And it's more than just equipment, and it's more than just broadband. It's also, if you're doing a visit over the phone, you lose certain cues, like visual cues. You miss the nodding of the head or the puzzled look that a patient might give you that, like, I need a little bit more guidance in what you're saying. All of that is lost. And so our providers have been having to really, think about how they're explaining things to patients. Now, luckily, all of our providers are bilingual, so already we feel like we have a heads up there, but so many other places are not, and it's challenging. And so for even although telehealth has been, like a game changer, it's not without its challenges. So I would say that's probably the primary issue that we're facing right now. And then maybe secondary, a lot of our, staffers, luckily we've been able to have a lot of them work remotely. But most of the folks who are employed at Esperanza are also from the community. And so they're having some of the same struggles that our community members are. And so we're helping, them through that process. But it's challenging, when they're also living in multi-generational households, where they need more technology support. So, we're doing everything that we can, but, we see some similar challenges as well.
Thank you. Dr. De Dios?
Yeah, and I think that just to amplify on what Carmen is saying, that primary care piece is affecting also the emergency department side, right? Because what I'm seeing is that during the peak of the pandemic, hospital volumes were actually down. And it was largely because if you didn't have COVID, you were hesitant to come to get anything else checked in the hospital for fear of contracting COVID. And right, so I think that our messaging was so good at telling people to stay home. It's almost like we went to the other extreme, that people with, weakness on one side that could be a stroke waited to be seen, or patients who had chest pain were waiting to come to the hospital to get checked out. And so now we're seeing the repercussions of chronic disease that have not been kept in check for a long time because of the challenges with telehealth and just the challenges with picking up on those cues that primary care providers can pick up so readily because they know their patients well. So they come to the ED with their sugars are extremely high, or they didn't know that they had a heart attack, that chest pain a week ago was a heart attack, and now they're in full-blown heart failure. In fact, I know that the city had an increase in out-of-hospital cardiac arrests during the peak of the pandemic, and most of those were not COVID. They were just chronic heart disease that usually these people would have come to the hospital to get checked out before having a fatal event. From the provider standpoint, it's extremely challenging to connect with patients that you don't know well when you have to be wearing personal protective equipment all the time. And I think that that's one of the biggest challenges on the provider side. We've had to learn to as Tyra Banks, do the smizing thing, because, you know, your face is always covered, both to protect your patients and protect yourselves. And I think that the shifts have become just more exhausting because, you know, on a usual day, and Carmen can attest to this, right? You just wash your hands in between patients and you just go to the next one. But now, especially if they come in with any respiratory illness, it's constantly having to assume that what I'm dealing with is COVID because it's so infectious and because it has such high morbidity. And so it's just that much more effort to get yourself protected, make sure that you're protecting the patient, make sure that your staff is not going in and out of the room frequently. So again, for these patients that are coming into the hospital already worried that they might have COVID, now they're extremely isolated, not only from their family members who are not allowed to be at the bedside with them, but even from their healthcare providers who normally might spend a little bit more time in the room to socialize and to maybe have that personal connection. And so that, I think, has an additional weight and really really affects the psyche, not only of the patients, but also the providers who are trying to have that human connection with them. I'm lucky enough that at our site we had enough personal protective equipment, although we did go through a period where we were recycling things. So even my N95 mask, I have one that I've saved that has 7 tick marks because it actually went through 7 washes so that I could reuse it. But again, I still at least had it. We never, I'm not aware that we were in the same situation as our colleagues in New York, for example, who went sometimes whole weeks using the same mask. But as we prepare for kind of the next season, I wonder how it's going to look, right? Especially with flu season coming along.
Thank you. And we have a couple more questions, or I have a couple more questions to stay in line with this whole mask wearing, right? Not only are you both health experts, and that's what you do as a profession, but you're also in the communities, you're with your family. And so I'm sure you've experienced potentially people who, for whatever reason, don't want to wear their mask or don't wear it properly. So I'm curious if you could give briefly the audience tips, right? Sometimes our culture, it's beautiful, it's wonderful, but we can be hard-headed and we can be tercos, right? We know this for good and bad stuff. And so I'm curious, just like brief, ideas on how to convince or ensure that people are wearing their mask and they're wearing their mask properly. And I'll ask Carmen to address that first.
Yeah, I think it's about finding what's important to every individual person. So I'll use, my parents as an example. For them, it was really challenging not to get to see their grandkids, on a regular basis. Because, I would see my nieces, my nephews, every week or so, and my parents as well. And so this has definitely taken an effect on them. But knowing that if both groups of family members are wearing their mask and they've gone X number of days without any symptoms, they could then see each other. So it's, I think, finding that common ground and say, this is the reasons why you want to wear your mask, because it'll lead to this goal that you have. And so it's really getting to the root of what's important to them, I would say.
Dr. Del Rios?
Yeah, I think Carmen stated it very well. I think it's sometimes blackmailing people a little bit. Well, if you don't wear your mask, then I'm sorry, I can't see you. I can't socialize with you. And I think a lot of it is just modeling good behavior. I think that I've had parents ask me, well, how can I convince my son to wear their mask? I'm like, well, if you wear it and you don't complain about it, then, imitation is going to happen, right? And so as long as both just knowing when to blackmail people in a nice way and also just modeling good behavior. I don't get into arguments with people that I don't know, but I do get into arguments with people that I know and love. And so it's part of showing that love by protecting others.
Thank you. And this is a final question for you both. I really want, hopefully, not just the folks that are on this webinar to take away important messages, but hopefully they take this to their constituents, their family members, etc. What message do you want the Latino community to know regarding COVID-19? I'll leave that general and broad. I'll allow you a lot of flexibility to address that. But we know that fall and winter is coming, and we've heard reports and rumors and you know, a lot of information around because of certain reasons that it's going to be, you know, the second wave, etc. How can people prepare themselves for the fall and the winter? And I'll ask Dr. De Rios to address that first, please.
I think one thing that is really important to remember is that we're in this for the long haul. I wish I could say that in a month or two, we're going to have a reliable vaccine and that we can do massive immunization and somehow we're going to be protected. But we know, and Carmen knows this because she's about to start clinical trials in Esperanza, this is going to be a while before we have any reliable immunization or treatment. And so really our best way to protect ourselves is just general hygiene measures, making sure that you're wearing a mask consistently, that you're staying, you know, 6 feet apart from other people, particularly in closed spaces, that you're washing your hands frequently, that you're cleaning surfaces, and that you really just make that a habit. It's all about making it a habit. And then, you know, if we're surprised that something comes along the way, then great, but I wouldn't count on that. And I would be really careful with where people are getting their information, that they go to reliable sources, that if there's anything that seems odd, that they discuss it with their healthcare provider before making any decisions about odd treatments or, you know, anything that they might have seen in the internet. Reliable sources and good hygiene. I think that would be my message for everyone.
Carmen?
Yeah, very similar. I agree that it's going to be a while before we go back to any type of you know, normal activities that we had prior to the pandemic. And so I think it's really thinking about what are some of the things that might have changed throughout this year that you could appreciate, that maybe you will continue sort of moving forward. I think definitely staying in contact with your healthcare provider for long-term primary care needs. It's still going to be important that folks, you know, go in for their mammograms and their colorectal cancer screenings. Like all of that is still super important. And so really, you know, calling your medical, you know, provider and saying like, what is the system that you're using to keep everyone safe for me to make my appointment in advance. It's also about maybe if you're thinking about how am I going to, you know, spend the holidays with my family this year, start making like those plans really early on and thinking about who is really in your core family unit, how you might host something that won't put folks in you know, dangerous, unnecessary situations. So really starting to think about that because it's probably going to be well into next year before we really get a vaccine. We do have a webinar that we'd be happy to share specifically on vaccines, and that talks a little bit more about the trials. They are 2 years long. And that's really because they want to know how long a vaccine is protective on someone. So if you, so folks are going to be, you know, monitored for a nice amount of time, but there's still too many unknowns. And I think that to Dr. Del Reyes's point, that there at the beginning of the pandemic, there were things that we weren't sure of, but that we now are sure of. So for example, I remember back in March and April, I would come home from the grocery store and start wiping down all of my items. And we know now that that's, you know, very, very far secondary from what the primary exposure and transmission is, which is person to person. So really thinking about what are the things that have already been confirmed that you could focus on.
Yeah, I did the same. I wiped down every item from the grocery store, and my mom called me crazy, but I thought I was doing the right thing. That's what I was told to do. So I want to thank Dr. De Rios and Carmen for your knowledge, your insight, and if you can stick around to answer a few questions, I'm going to go over a couple of slides here, and then we'll transition to the Q&A. But thank you so much for all the information that you've shared. To the folks on the webinar, as promised, I want to show the correct slide around deaths. My apology for the miscommunication there, but let me go ahead and share this here. It's going to go through all this again. All right, there we go. I don't know if Sylvia, if you want to, I know that you addressed it, but these are the correct numbers, the top 15 zip codes by per death, ranked by per death.
Yeah, and I think, again, the point here is this is just linking that we are seeing the emergence, regrettably, the continuation of deaths in the African American community, the disproportionate deaths, and also regrettably, we now can say that the #1 community on this chart is South Lawndale Little Village. It's been in the top 5 for the number of cases of COVID, and now regrettably it's #1 in the state in terms of people who have lost a loved one. It really hurts to say that, guys. But we're definitely seeing the link here between the incidence of COVID and folks who are passing away. So I did see, so yeah, and then you're going to get to the questions. So that's all I wanted to say, Roberto.
So yeah, just wanted to share that again, wanted to make sure that folks did see the correct data. And so I'm going to be brief. I don't want to take time away from the Q&As, but a few resources. The folks on the panel here, Sylvia, Dr. De Rios, and Carmen are part of Illinois Unidos. I shouldn't say we, have developed a one-pager around issue education that I'll share in just a sec. But the group has done many things, and honestly, we can do a webinar just based off of the great work that folks have done. But just a few, we produced multiple press releases that have translated into media articles that really, I think, has kind of rung the bell and the alarm on the disproportionate impact of COVID-19 on the Latino community. But I did want to put out that for folks, we do have bi-weekly meetings every other Saturday. Yes, we have Saturday morning meetings, but these are very important meetings where we talk about, what's going on in the community, a lot of the conversations and information that Dr. De Rios and Carmen shared. So I will follow up with the group that RSVP to see if anyone's interested. Would love to get other perspectives. From the forum's perspective, or from the forum's website, we do have a resource page that we've been trying to update as much as we can since the beginning of the pandemic. Again, I'll send around that information, but we just created a data page where the data that we just sent out last week and we just showed right now, we'll be updating the cumulative every 14 days, and then we'll be updating the zip code data every month, essentially. So that's the link where you can go see that information. And we do encourage folks to use the data as you see fit, and hopefully continue this conversation. And then finally, we do organize monthly Acuerdo meetings. Those are community-based network and service providers who are really doing the great work on the ground. And so again, if folks are interested in participating in those meetings, I'll send a link so folks can sign up for it. So with that, I'm going to stop sharing my screen and let's get to the questions. Go ahead, Sylvia.
Do we have a visual of some of the recent?
Yes.
Really want to thank our doctors and our health professionals who have curated so much of the material and found out there wasn't really a lot that was available in Spanish that was easily understandable. So working with our physician group and healthcare providers, as well as the Forums communications team, we're about to release these series of 10 infographics that share basic information really geared to what I think is Don Juan and Doña Maria on the street. They're going to be available in English and Spanish that answer basic questions. Who is at high risk of contracting COVID? How do I know if I have it? What are the symptoms? And again, these are going to be available in English and Spanish. They are almost done. They should be available in the next week. And we really want you to use them, or spread them far and wide. We think they're creative. We think they're novel. The physicians curated and looked at materials from all over the world, really, even Latin America, and didn't really find anything else that looked like this. So we're very proud of this fledgling effort of Illinois Unidos, which is an all-volunteer coalition, which is also met with the governor's office, the mayor's office, Cook County President's office. You look at the website, you'll see a series of press releases, all of which have recommendations. So we want you to know that this group is working very hard on trying to get recommendations in place that we think can hopefully stem some of the tide of COVID. And certainly we would encourage any of you to join us and advocate with us on those efforts.
Thank you, Sylvia. And as she mentioned, as Sylvia mentioned, we'll be sharing those one-pagers on the on our website, on the Illinois Unidos website, and then I'm assuming our partners' website as well, if they're willing to share. So thank you so much. All right, well, we'll get to Q&A, and again, so many great questions. I know I want to set proper expectations, probably not going to get to all of them, but we'll try to follow up as much as we can. Let's see here. So Mario Perez has the question. I think, let me see. Okay, what are the underlying variables correlated, perhaps causing, the disproportionate number of positive cases and deaths in the Latino community? I.e., why is our community impacted so much more than others? Very general. And Dr. De Rios, can you address that first?
Well, there's the often put out medical reasons, and then there's the real structural causes, right? And so I think that in terms of transmission, the structural causes, right? The fact that when the governor put in place stay-at-home orders, that was not possible for a lot of people in the Latino community, right? Because of the places where we're employed, because a lot of us work, for example, in healthcare fields and throughout the spectrum, right? From technologists to, custodial workers to, people that are home health aides that had to continue to show up to work because there were patients to be taken care of. There's the restaurants and all the service industry pieces, right? That those are not the type of jobs that you can do from your computer. You actually have to show up and make those things happen. Transportation, food industry. Donald Trump very early on decided that, the meat packing plants were an essential service, and a lot of Latinos are employed in that area. We know that there were a lot of transmission in that area. And then there's the fact that, there's a lot of chronic disease in our communities, in part because of structural issues, lack of insurance, inability to access healthy foods or to maintain active lifestyles because of where we work and where we live. And so when you have also high rates of diabetes and high blood pressure and asthma and other chronic disease, that certainly puts also our population at a higher risk of having worse outcomes when they're infected. And so that combination has really proven to be deadly in our communities.
Thank you. Let's see here. I'll go to the next question here.
And this one. Sorry, can I just add really quick something to
please.
what
Go ahead.
Dr. DeRusso say? I would say also too that if we think about how there just really wasn't a national strategy for testing early on. We got started so late into the pandemic. We didn't have enough testing supplies. We were only testing symptomatic patients while the asymptomatic patients were, exposing and transmitting. But that was because every state, even healthcare entity was left to sort of fend for themselves and figure it out. And I think that lack of a strategy really is what made everything even worse.
Yes, and to my knowledge, there still hasn't been a national plan that's been addressed on so many perspectives. A question for you, Sylvia. I know, a lot of the work that we're doing at the forum really does focus on racial equity. So the question around discussing some of the systematic and policy strategies to secure safe working conditions for low-wage essential workers and providing cash and employment relief for those that are both left out and most impacted by COVID-19. Again, a lot of the work that we're doing at the forum.
Yeah. So the forum, thankfully, through our Illinois General Assembly this year, most of you hopefully know that there was $400 million made available for mortgage and rental assistance through the state of Illinois for people who qualified. In addition, the General Assembly did allocate about an additional $60 million, which will be used and primarily focused for economic assistance for immigrant families who aren't eligible for other kinds of assistance. So the forum is working with the state to make sure that those programs are designed in a way so that all of our community members are eligible, including those that are undocumented. And then we also know the challenge is that it's not very organized, but there have been numerous philanthropic efforts between the city and the state COVID fund, over 60 million, again, has gone out to various communities throughout the state. And a lot of our organizations, even those on the amazing job of raising money for emergency assistance that they've been able to disperse to people who are in dire need. The challenge is that the rent moratorium at some place will be lifted and that rent will come due. And that we know that at least a quarter of Latinos in the state have lost their jobs. And most of those jobs, many of those jobs in the hospitality industry are not going to come back. So in addition to this health crisis, we really are facing, I think, this economic cliff. To the specific question around, many of our low-wage workers, one of our recommendations to the city and the state is that we've got to make mobile testing available on site at places where there have been workplace breakouts of COVID. We should all be jumping on the wagon and figuring out how to support the amazing efforts of the University of Illinois in their test that gives results within 24 hours. And they've implemented on the University of Illinois at Champaign campus. They've made offers to share that with the city. How do we make sure that happens in a quick and more timely way? And as part of our Illinois Unidos coalition, we're still very concerned with the workplace incidence of COVID and have some specific recommendations that we're working on to try to make sure there's more consistent efforts, including accountability for employers. We feel that hopefully many employers are doing the right thing, but for those that don't or don't provide PPE, protective gear to their employees, that there really is accountability and investigation. And we've had conversations and we'll continue to have conversations with the Illinois Attorney General on this. So all of these efforts that we're undertaking, you can find at the Latino Policy Forum website. I believe they're also getting reposted to the Illinois Unidos website. And as Roberta said, you can stay in touch with us by participating in an Illinois Unidos meeting or in one of our Acuerdo meetings where we share these resources as they become available on an ongoing basis.
I think we have time for one question and if possible, brief response. So many good questions to choose from here, but I'll ask this, and I'm interested as well. How risky really is it to travel during COVID-19? I know that a lot of folks are staying home. The holidays is coming up, right? Some of us live out of state. How risky really is it? And I'll ask Dr. Rios to address it.
Well, so as of now, air travel, we don't have a lot of data to know how much transmission there has been from traveling, meaning just the physical space of being in a plane, right? We do know that that's how COVID made it to the United States, right, through travel. But I would say that being in an enclosed tube with many strangers and all breathing the same air is not an ideal situation to be in. Now, there's ways that you can protect yourself, right? So, and again, it goes back to these basic hygiene measures. Make sure that you're carrying with you disinfectant, that you wear a mask, that you avoid touching too many surfaces, and if you do, you wash your hands right away. I always say that you have to weigh your kind of health risk with also your mental risk and mental health. And if you really want to see a family member who you haven't seen and want to take the risk of travel, just be prepared and take care of yourself, and remember to quarantine yourself once you get to the other side, and try not to connect with too many people until you know that you're okay. But it's not 100% safe. That's all I can say.
Understood. So I'll give each panelist maybe, 20, 30 seconds, final words before we say goodbye to folks. And Carmen, if you can start us off.
20, 30 seconds. I would say, please, encourage, our community and our families to get tested, to please not feel like they're embarrassed about the results that they're gonna receive. Encourage them to get their flu shot this year. encourage them to stay in contact with their primary care provider, to really learn about, vaccines and how they work, and to just, really stay, connected to reliable sources. We're here always as a resource, a Spanish-speaking resource, so you can always reach out to Esperanza as an organization. So that's that. I would say that, traveling, everybody has their own risk profile based on your age, underlying chronic diseases, who you live with. So really think about that before making that decision to travel. Personally, I decide that, like, if it's unnecessary, I'd rather not. But everybody has a different situation. But consider all of those things.
Dr. Del Rios?
Yeah, I think that amplifying what Carmen said, all of us have our own risk profile, and I think that's the most important thing to keep in mind. And for people that may be still fearful about reaching out to healthcare providers for fear of, being exposed to COVID, know that we're all taking proper precautions to keep our patients safe. And that, again, to Carmen's point, making sure that everyone is maintaining their general health is one of the best ways to protect yourself from COVID, just ensuring that your diabetes, your high blood pressure, your asthma is under control, that you're getting immunized for what you can. Just maintaining your general health is super important, especially in the middle of a pandemic.
And Sylvia?
So just respond to one of the questions in the chat box on why COVID is higher. We definitely are seeing it higher even among various age cohorts, and we can respond to that further. We'll ask our doctors to respond to that. But I think when you look at the combination of Latinos having the highest levels of uninsurance, having such a high concentration of essential workers, where they're going into jobs where they're maybe continually re-exposed, especially those that work in the hospitality industry, you have less capacity to self-isolate because our homes are more likely to be overcrowded and literally geographically smaller spaces. Living in multi-generational households, you don't have as much capacity to self-isolate. And then what we've heard just about the cultural competency or challenges of that in terms of information getting out, what we're putting out, we haven't seen these kinds of accessible infographics available in English or Spanish. I just think all of these are just compounding factors, which I think have accelerated the rate of COVID in the Latino community. And the last point I'll make is, while the chart we showed at the beginning is never going to go down, when we look at the 14-day rate, which is what's being used to determine do we open up to the next level or not, that rate is somewhere in the range of 4%, maybe a little bit less now for the entire state. In our community, it's 12%, right, or over 12%. So even as we're looking at the rates of infection for the past 14-day rolling average, we're consistently seeing the rate being 2 to 3 times greater in the Latino community for all the reasons that we've just discussed. This is always really challenging because I hate to end on it is a crisis than it is challenging. I think the good news is that we have all of your participation. We have tremendous leaders such as our healthcare professionals, Carmen and Dr. Del Rios, and all of those that are part of the Illinois Unidos Coalition, who are really seeking to, A, bring in resources, B, come up with additional strategies, and C, really educate our community, which we know is strong and resilient, and we'll get through this. We may have a few battle scars along the way, but I'm confident that we definitely will come out stronger and more resilient on the other side. And really thank everybody on this call and all of you for participating today.
Absolutely. I'll echo Sylvia's sentiment and words. Thank you so much for every attendee today, for the panelists, for giving us your insight. We'll share all the information, try to answer all the questions that were asked. And with that, we'll say goodbye. Enjoy your weekend. Take care.
Thanks, everybody.